Here is the lecture, part 1 on nonverbal communication. Some of this was started in class. We kind of introduced nonverbal communications. So I'm going to skip through the first ones, but kind of just introducing the concept that we cannot not communicate. So the next, the 15 minutes of this video is going to start introducing different types of nonverbal communications. So there's different categories that different types of communication can fall, nonverbal communication can fall into. And it just kind of goes deeper, like what messages do those sound, what are norms, things to be aware of, and what messages are you sending without even opening your mouth. So just to recap, you're going to want to know the 5 roles that nonverbal communication plays for the quiz next week. So just remember, it's repetition, contradiction, substitution, complementing, and accenting. You will not need to describe what those are, but you just need to be aware of the 5 roles that they play. All right, so jumping in, first 2 types of nonverbal communication that you need to be aware of is the chronemics. So that's essentially time. So think of like chronological time, if that helps kind of help you remember what exactly chronemics means. But it's the study of the use of time in nonverbals. So the bullet points underneath them give some examples of what chronemics is. So you can kind of reflect this concept back to the 50/50 video that you had watched. We talked in class how the therapist, Anna Kendrick, didn't really demonstrate managing time well, so she wasn't prepared when the client came. And so that sent a message possibly to the client that she wasn't ready, that she wasn't prepared, that his time wasn't valuable, and that maybe she's a little scatterbrained or she's not on top of things, and that can leave an impression on the client and not necessarily build that trust and confidence that you're looking for in engagement. Nonverbals don't happen just in engagement. It can happen throughout the whole duration of the clinical relationship. And so if you're constantly bringing your client back late for sessions, that can be interpreted negatively because, again, that can send the message that their time or they are not valuable. And so they're seeing that lack of time management as something negative. Coming too early, again, that scheduling piece might be indicating something. The client might interpret that differently. The interesting thing with chronemics is, though, a lot of this could be culturally tied. And so we often see in some cultures, one that often comes to mind is Hispanic culture, that time is looked at differently. It's not necessarily that clock time of like you have to be here at this time. It's a little bit more loose and interpretive. And so having clients who historically come late, that is something to consider. The cultural piece. It also might be an environmental piece. What time does the bus come? Do they have access to transportation that's reliable, that is able to get them there on time? So you want to look at those things as well, because that might be a piece of data collection. Yep, that kind of sums up chronemics. One of those things that isn't necessarily on your body or part of your body movements, which we'll talk about in a little bit, but it's definitely a nonverbal piece that you need to consider. Artifactual is the second one. So those are messages conveyed by objects. So this ties in directly to our office assignment, where you're looking at like what's in your office and what are you doing with those certain things. So looking at your physical setting, you guys might have just noticed my nonverbal. My phone was blowing up in my pocket, and I just subtly grabbed it out to see what was happening, because typically when my phone goes off multiple times, it's an emergency. So those are some nonverbals. So like I'm not paying like super close attention to my camera because I was distracted by something. So that could be if my phone was out and that was an object and it was ringing, 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 and the client heard it. That could be distracting to the clinical thing again, kind of tying into the time, like, hi, I'm here in your space, but you're not valuing me as a person, type of thing. So going back to artifactual, sorry, that was a tangent. Obviously the phone distracted me from the task at hand. So artifactual, physical setting, the office assignment is going to tie in completely to that nonverbal communication. So like what types of things do you have in your office? How is the aesthetic? How is the feng shui? What message are you sending to your client? So even you can utilize artifactual nonverbals if you would do a home visit. So looking at a client's physical space, what types of decorations on there? Is it overly cluttered? Is it sparse? Are there bed bugs? Are there, is it sanitary? Like if you're working in child welfare, is there something going on that might be a red flag for safety for children? Trying to think what else in there. It's like magazines on the table. That can say a lot about you. So the more neutral you can keep the artifacts in your office space, the better, because then the clients aren't making judgments or assumptions about your taste or your style or your preferences. But again, if you kind of flip that and think about if you're going into the client space, looking at what types of magazines are on their table, you might be able to get a glimpse into kind of what they're interested in, or I don't know, red flags again. So if there's content in the magazines that might be problematic to the issues that you're working on, it's something that you could reflect back on. Wedding rings are a artifactual one that can kind of give you a glimpse into your personal life. Like I'm wearing a wedding ring. You can make the assumption that I'm married. I actually used to wear a kind of misleading ring before I was married, just to kind of take any questions off the table of my single status, or having a client think that they maybe had a romantic chance with me because I was not married. I always just did that as part of a safety thing, just to kind of deflect any vulnerabilities that I might have as a single female in a clinical setting. Length of hair, that could be a judgment made, I want to say, kind of maybe sometimes towards males. So if you have longer hair, that can be interpreted as unkempt or not professional. I think about like tattoos. Those might be very unfair assessments, but it is something to be aware of. So in summary, chrometics is type, artifactual is messages that are conveyed by objects. All right, moving on to smell and touch. We talked briefly about smell in class. Some of you brought that up in regards to the smells of the office. Scents can send a message, your body odor. So if you have a strong body odor, maybe stinky, that could be an indicator for a clinician, if you're observing your client having a strong body odor, that they're not attending to their call them ADLs, activities of daily living. So not taking showers, not washing your clothes. That's often a sign of decompensation for clients, that if they are presenting with more of a disheveled appearance and the smell is kind of tied in there, it might be a sign that we need to intervene because an individual is not taking care of themselves. It also might indicate that they might not have access to resources to be able to take care of their activities of daily living. So maybe not access to laundry soap, shampoo, body soap, those basic needs that are basic essentials to take care of their needs. And that might result in like, hey, let's do a referral, or let's look at how we can budget differently, or maybe you just don't have the means to get those things. Can we connect you with community resources? I always laugh at like the smell of cigarette and marijuana, working with clients who are like, nope, I haven't smoked in 10 years. You smell like you just rolled around in a bunch of nicotine. Maybe you're not telling me the truth. And so I like to use smell and reflecting that discrepancy when working with clients who may have had a goal of quitting smoking, or some programs don't allow the use of marijuana. Now things have changed a little bit with it being legalized, but prior you couldn't, like the program I did not use a program. The program I worked in, for housing, one of the parameters is where you couldn't be using drugs, and so marijuana had fallen under that. And so when I could clearly smell it on my clients, I kind of had to figure out how to reflect that discrepancy to kind of make sure that they were complying with program requirements. Something for females, I would say maybe more so than males, typically strong perfume scents can be triggering for clients. It could remind them of something. It might cause some physical reactions. So like my mother-in-law she gets very triggered, like with migraines by smells. And my 13-year-old probably single-handedly keeps Bath and Body Works in business because she uses so much perfume that when she comes into my house, my mother-in-law does, she can immediately smell if my 13-year-old is home or not. And she has a very negative reaction to it. And so thinking about that from a client clinician perspective, if you are wearing a very strong perfume or cologne, just knowing how that might impact your client and erring on the side of caution with that. Same with like diffusers or air fresheners. The smells can be triggering both positive and negatively for a client. Calming scents in the office, like I said, just kind of mentioned there, like it can be very therapeutic. Like lavender has like the therapeutic benefits of being calming, but too much of it can trigger or possibly remind them of some sort of traumatic event or person. So being aware of that. One of my clients, it was very difficult working with him because he presented with such strong body odor that was largely associated to his copious amounts of cats that he had in his household. So we had a very, very difficult time working with him because from a clinician standpoint, we could not breathe very well when the client was in our office. You could actually smell him coming off the elevator, and we knew the client was coming in. And so we had to work very hard in kind of holding back some of our judgments and our biases and our own physical reaction. I ended up having to put Vicks Vapor Rub in my nostrils, but prior to him coming in, otherwise I had a difficult time actually physically making it through a session. And so if you're thinking about upholding clients' dignity and self-worth, it was very easy to think very negatively of this client and kind of look at that very strong nonverbal versus hearing what he was saying and kind of identifying what is going on that might be causing some of these issues. But then also having a really uncomfortable conversation with him, like, your smell is horrible. Like, trying to figure out how to say that in a very tactful way, but not addressing it also is not very therapeutic because it's obviously impacting his social interactions. And so using that nonverbal presentation as a therapeutic tool to help the client, like, that was a really hard one for me to navigate in the clinical practice I was in, because I kind of have a pretty whatever approach. I was given a lot of the harder, difficult clients, him being one of them. A lot of the clinicians just found it very that they weren't able to provide him good services. So I inherited him from other caseloads and had those tough conversations. And sometimes he would take them well with me. Sometimes he would, if a conversation about his poor hygiene would lead into, well, I'm just not worth it. I might as well go kill myself. And that kind of had to address and work there. So that was a very interesting nonverbal, and definitely something that often distracted, I would say, from problems at hand, because we spent so much time dealing with it because it was so in your face. I'm going to stop the video here because I want to talk about touch, but the video is going to cut off in about a minute, and that's not enough time. So as a recap, because you're going to want to know these different categories for the quiz and for your practice in general, we discussed chronemics, which is time, artifactual, which is messages conveyed by objects, and we discussed how smell and sense can project a message, whether good or bad.